start, I want to touch on why nutrition is important for any kind of oncology patient, not just for patients with neuroendocrine tumors. Some benefits of healthy eating is that it actually helps improve your tolerance to the treatments that you are receiving. And what I mean by this is that for many cancer types, if you're a patient who is losing weight, you are also losing lean body mass. And studies have shown that if you are losing lean body mass, this can actually increase your risk of toxicity from the treatments. And studies have shown that this could potentially lead to receiving less treatments compared to those patients who aren't losing weight. Healthy eating can also help support your immune system. If you are not eating adequately and you're losing the lean body mass that I mentioned before, this can lead to long-term consequences. Typically what this means, it means that you are more likely to have poor wound healing. You are also at an increased risk of acquiring an infection. Now, unfortunately, many patients, when they're going through treatments, they do report more than one side effect. And this could include a variety of things from nausea, it could be vomiting, diarrhea, decreased appetite, and unfortunately the list goes on. Medications are implemented, but sometimes you could feel a little bit better if you couple those medications with nutrition therapy. Now, with that being said, where do you start? There's so much information on the internet, especially I feel over the last few years, there's a lot of different diets on the internet. It's hard to know where to start. I would definitely encourage you seeking the advice of a registered dietitian, especially one who is certified in oncology nutrition, but this is a good place to start. I like to refer to the American Institute of Cancer Research. They have 10 recommendations for cancer prevention that can be very helpful. Now, I know what you're thinking, these are for cancer prevention, this doesn't apply to you. However, it does. They recommend that even after you have been diagnosed, that you actually continue to follow these recommendations during your treatments and after treatments, and as many suggestions as possible. Now, some of these recommendations are to try to maintain a healthy body weight, stay physically active. They also recommend to consume a more plant-based diet, also try to reduce your intake of red meat. Red meat does include pork, beef, and lamb, and I typically recommend for patients to try to consume less than 18 ounces in a 1-week period. Now, in terms of things that you should try to limit and avoid as much as possible, that includes processed meats, sugared, sweetened beverages, and kind of like sweets, and then also junk food. And the reason for this is because these are tied to empty calories. The empty calories are going to lead to weight gain, and being overweight and obese has been found to increase your risk of certain cancer types. So this is a great place to start, especially if you aren't symptomatic, if you aren't having any kind of symptoms from carcinoid syndrome, for example, or if you're going through treatments and your symptoms may be minimal, this is where I would recommend for you to start. And that sounds great in theory, but how do you actually implement that? So the AICR actually came out with this infographic that I think visualizes it pretty nicely. They take a standard dinner plate. 2/3 of that dinner plate is going to be all of your plant-based items. So it's going to be your fruit, your veggies, your whole grains, your beans, and then the remainder third of your dinner plate is going to be your animal protein. And I would go a step further and actually suggest that if you do like seafood, that at least once a week that actually be a fatty fish source like salmon. So as I've mentioned before, the previous recommendations can be applied to several different cancer types. If you seek the advice of a dietitian, she's going to be taking several different things into considerations, especially if you do have a neuroendocrine tumor. Some of those things would be the primary site. The treatments would also be taken into consideration, as well as the side effects that you would be having from those treatments. And the reason for this is just, even if you have the same tumor type, you may not necessarily respond the same way to some of the nutrition therapy. So because of time constraints, I cannot get into all of the treatment-related side effects. However, I will touch on diarrhea because it is a side effect that demonstrates well the difference in the interventions for just general diarrhea and for those who have carcinoid syndrome. Easy place to start if you have just general diarrhea is to start with pectin-containing foods. The reason for this is that it's actually a soluble fiber and will actually help bulk your poop. Some of these foods include bananas and applesauce. Basically, the brat diet is kind of what you want to think about. The bananas, the rice, the applesauce can be pretty effective. Next, your dietitian may recommend to include pectin supplements, especially if the pectin-containing foods aren't enough or you just can't eat enough. Some examples include Benefiber or Banatrol, which is basically just banana flakes, and you can find these over the counter at most stores or even Amazon. And typically for these, we would recommend about 1 to 3 times a day, and we would start you off once a day and slowly titrate up. Now, the reason for most dietitians kind of pushing bananas is because it contains potassium. When you have diarrhea, you lose quite a bit of sodium and potassium in your stool. So bananas is an easy way to get your soluble fiber and replenish some potassium, but it's also easy on the stomach. So some other suggestions that you could implement, especially if you're having steatorrhea in particular, where you're malabsorbing fat, you would actually want to avoid greasy or fried foods. Some other tips that you could implement would be avoiding spicy foods or even very sweet foods or beverages. And if you do feel like consuming something that's a little bit on the sweet side, a solution that you could trial is to dilute it with water. And typically 1 to 1 is the ratio. So if you want half a cup of juice, you would dilute it with half a cup of water. Another suggestion would be to try to eliminate lactose sources, particularly milk, especially if you've been having diarrhea for a few days. Many patients can become sensitive to lactose, even if they haven't been in the past. So this is another easy suggestion to implement. You would also want to avoid high fiber foods. And I know I previously said you want soluble fiber, but in terms of insoluble fiber, this would actually increase transit time, which you don't need at this time. You're already having diarrhea. So some of these insoluble food sources would include things like popcorn, things like cabbage or broccoli, and even nuts and seeds, for example. And then, of course, medications can be trialed, and these recommendations would come from your physician primarily. So diarrhea with carcinoid syndrome is a little bit different. It can occur several times a day, similar to regular diarrhea. However, with carcinoid syndrome, antidiarrheals may not necessarily be effective. So the Imodium and the Lomotil may not work. It may not necessarily slow at night when you're sleeping either. And if you fast, it may not slow either. And unfortunately, this will result in dehydration and electrolyte abnormalities, which could increase your risk of malnutrition, which is why it's important to definitely work with your physician and your dietitian to try to help alleviate your symptoms as much as possible. But what are some things that you could implement if you're having diarrhea due to the carcinoid syndrome? You could consume small frequent meals of a low amine, high protein diet. And I'll get into that a little bit more in the next couple slides. Dry flushing. Dry flushing is another symptom of carcinoid syndrome that could benefit from nutrition therapy. Now, the reason for that it's called dry flushing is because there's no perspiration involved, and dietitians like to use the 5 E's as a way to remember the things that can worsen your symptoms with dry flushing, and that is basically eating, epinephrine, your emotions, ethanol, and exercise. Now, the nutrition interventions for dry flushing, you'll notice that they're similar to the ones for diarrhea due to carcinoid syndrome, and that's to avoid large meals, avoid alcohol, which is the ethanol that I previously mentioned. You would want to avoid spicy foods, and you would also want to include a high protein diet, but also low in amines. Now, the reason for this is that amines are actually You want to think of them as almost like the building blocks to the catecholamines. And what that does is it stimulates the production of serotonin, which will increase your carcinoid syndrome symptoms. Now, the low amine diet. These are the foods that you would either want to eliminate or minimize as much as possible. And this is why it's important to see a dietitian, because she can help you kind of balance this and make sure that you aren't low in vitamins and minerals. Some of the things that you would want to definitely avoid would be aged or hard cheeses, alcohol, salted, smoked animal proteins, any kind of spoiled animal protein, yeast extracts, brewer's yeast, hydrolyzed proteins, fava and soybeans, and fermented foods. There's quite a bit of things on this list, which is why I will kind of continue to endorse that you meet with a dietitian so she can help you manage this. Now, why is the high protein diet so important? Even if you're not going through if you're not having symptoms from carcinoid syndrome at the moment, your tryptophan level can be low. This is an essential amino acid that can only be found in complete proteins, and it's a precursor for serotonin. We need tryptophan because it is necessary for the synthesis of proteins, but also niacin, which I'll touch on why that's important. Some symptoms of niacin deficiency is more diarrhea, and that is not something that you need more of at this time. You'll also have dermatitis, so scaly brown patches on your arms and legs. In more serious cases, dementia, nervousness, and even depression. Weight loss, poor appetite will just further contribute to this niacin deficiency because you aren't getting enough in. Now, how do you treat a niacin deficiency? So your dietitian or physician will typically recommend a high protein diet, and they will start you on a multivitamin and also supplement with niacin as well. And they will determine if this is truly needed by looking at your weight loss history, if you're having flushing symptoms, poor appetite, or if you have an elevated serotonin level. Now, some food sources of niacin, there's animal proteins such as chicken and beef. It can be found in fruits as well, like avocado, dates, and passion fruit. Vegetables like mushrooms, broccoli, asparagus, and then tryptophan you can also find in food sources as well, and that would be animal proteins such as chicken, turkey, also eggs, sunflower, pumpkin seeds, peanuts, and soybeans. So kind of eating a variety of different things, and if you'll notice, a lot of plant-based items as well. Now, should you avoid foods with serotonin, especially since we're talking about serotonin being the cause of a lot of your symptoms? Short answer is no. You don't want to avoid foods with serotonin. The only time you would want to avoid foods with serotonin if you are doing a 24-hour urine collection for the 5-HIAA test. And this basically measures the breakdown product of serotonin. Serotonin from food sources will not affect the tumor growth or your symptoms. Now, just to summarize all of this, if you're symptomatic, you would want a high protein diet, low in fat. You would want to make sure you're staying very well hydrated, especially if you're having diarrhea. You want to decrease added sugar, limit or avoid spicy foods, and then, of course, have a more low amine diet. Thank you.